اي دكتورة واضح.
اوكي. مثل ما اخذنا بالبارت 1 اخذنا الانفكشنز بالاوربت، اخذنا البريسبتال سيلولايتس والاوربيتال سيلولايتس، واخذنا البلو اوت فراكشر. اليوم راح ناخذ بالبارت 2 الثايرويد اي ديزيز والفاسكولار تيومرز اللي هي الكابيلاري هيمنجيوما والكابرنس هيمنجيوما. ثايرويد اي ديزيز كلكم ماخذيها بالميديسن، فناخذ في اوفر ريفيو سريعه عليها. احنا نحكي عن thyrotoxicosis اللي هو الهايبرثايرويدزم which is a condition involving excessive secretion of thyroid hormones. The Graves' disease اللي هو most common subtype of hyperthyroidism، هو عبارة عن autoimmune disorder in which IgG antibodies bind to thyroid stimulating hormones receptors in the thyroid gland وstimulate the secretion of thyroid hormones. It is more common in female than male. ممكن associated with other autoimmune disorders. عدد البرزنتيشن مع thyrotoxicosis بالthird to fourth decades with weight loss, appetite good, increase bowel frequency, sweating, heat intolerance, nervousness, irritability, palpitation, weakness and fatigue. On examination signs عندنا external و cardiovascular signs. بالنسبة للإكسترنال هنشوف diffuse thyroid enlargement مثل ما تشوفون بالصورة، hand tremor, palmar erythema, warm and sweaty skin, finger clapping and onycholysis. هنشوف البريتيبيال myxedema which is infiltrative, dermopathy characterized by raised plaque on the interior aspect of the legs extending onto the dorsum of the foot. هنشوف alopecia and vitiligo, myopathic proximal muscle weakness. بالنسبة للكارديوفاسكولار ساينز هنشوف يعني هنلقى البيشنت عنده sinus tachycardia, atrial fibrillation and premature ventricular beats، والبيشنت حيكون عندهم ممكن high output heart failure. investigation نسويه للثايرويد patient with thyroid eye disease أو الثايرويد يعني thyroid dysfunction هنسوي السيروم T3 T4 TSH, thyroxine binding globulin and thyroid stimulating immunoglobulin. عندكم هواية treatment options اللي هي الكاربامازول, propylthiouracil, propranolol, radioactive iodine and partial thyroidectomy. فاحنا نحكي عن risk factor of patient to develop thyroid eye disease. Once the patient has a Graves' disease, the major clinical risk factor for developing thyroid eye disease هو smoking. The greater the number of cigarettes smoked per day, هيكون a patient with a greater risk to develop thyroid ophthalmopathy. Giving up smoking seems to reduce the risk. Women are 5 times more likely to be affected by thyroid eye disease than men, but this largely reflected by the increased incidence of a Graves' disease in female. بالنسبة للpathogenesis of ophthalmopathy, in two major important causes بالنسبة للpathogenesis. The thyroid ophthalmopathy involves an organ-specific autoimmune reaction in which a humoral agent, immunoglobulin G antibody, produces the following changes. The first هيكون عندنا inflammation of extraocular muscles characterized by pleomorphic cellular infiltration associated with increased secretion of glycosaminoglycan and osmotic imbibition of water. So the muscle will become enlarged, sometimes up to 8 times their normal size. Then it will compress to the optic nerve. Subsequent degeneration of the muscle fibers eventually leads to fibrosis, which exerts a tethering effect on the involved muscle, resulting in a restrictive myopathy and diplopia. إذا في البداية حيكون عندنا congestive myopathy، بعدين حيصير عندنا restrictive myopathy. Number 2, inflammatory cellular infiltration with lymphocyte, plasma cells, and macrophages of interstitial tissues, orbital fat, and lacrimal glands with the accumulation of glycosaminoglycan and retention of fluid. This will cause an increase in the volume of orbital content and secondary elevation of intraorbital pressure, which may itself cause further fluid retention within the orbit. So this will increase the orbital volume or the orbital content volume. راح نجي هسه بالنسبة للclinical features أو يعني هنحكي اللي هي thyroid eye disease. Sorry. Thyroid eye disease, we have 5 main clinical manifestations. أول واحدة هي soft tissue involvement. We have lid retraction, proptosis, optic neuropathy, and restrictive myopathy. This is in general. But we have two stages of the development of the disease. We have the congestive inflammatory stage and the fibrotic or leukocytic stage. The congestive or inflammatory stage, in which the eye are red and painful. This tends to remit within 3 years, and only 10% of patients develop serious long-term ocular problem. After that, we have the fibrotic or leukocytic stage, in which the eye are white and quiet, although painless motility defect may be present. احنا نحكي على كل وحدة من ذني signs أو features of thyroid ophthalmopathy. أول وحدة هي soft tissue involvement. طبعا هي تعتبر congestive أو inflammatory stage. Patient may experience grittiness, photophobia, lacrimation, and retrobulbar discomfort. On examination, we have epipulbar hyperemia, which is a sensitive sign of inflammatory activity. Intense focal hyperemia and congestion may outline the insertions of horizontal recti. ممكن هنشوف عند البيشنت periorbital swelling, which is caused by edema and infiltration behind the orbital septum. This may be associated with chemosis and prolapse of retroseptal fat into the eyelid. كمانجمنت للبيشنت with soft tissue involvement عادة نعطيهم lubricant for corneal exposure and dryness. We will use topical and anti-inflammatory agents like steroid, non-steroidal anti-inflammatory drugs, or cyclosporine are advocated by some authorities. We will advise the patient for head elevation with 3 pillows during sleep to reduce periorbital edema. Eyelid taping during sleep may alleviate a mild exposure keratopathy. Now we'll talk about lid retraction, the other sign of thyroid ophthalmopathy. The causes or pathogenesis of lid retraction. Retraction of the upper and lower lid occur in about 50% of patients with Graves' disease as a result of the following postulated mechanism. We have 3 mechanisms. The first is fibrotic contracture of the levator associated with adhesion to underlying orbital tissues. The second one is secondary overaction of levator superior rectus complex in response to hypertrophy produced by fibrosis and tethering of inferior rectus muscle. The third one, which is humerally induced overaction of molar muscle as a result of sympathetic overstimulation secondary to high levels of thyroid hormone. The signs of lid retraction. Usually, we have the upper lid normally raised 2 mm below the limbus, the corneal limbus. Lid retraction is suspected when the margin is either leveled with or above the superior corneal limbus, allowing the sclera to be visible. This is called scleral show. Likewise, the lower lid normally raised at the inferior limbus. Retraction of the lower lid suspected when the sclera shows below the limbus. Lid retraction may occur in isolation or in association with the proptosis, which will exaggerate its severity. Management. Mild lid retraction does not require treatment because it frequently improves spontaneously. Control of hyperthyroidism may also be beneficial. Surgery to decrease the vertical dimension of palpebral fissures may be considered in patients with significant but stable lid retraction. Now we'll talk about proptosis, which is usually axial. It could be unilateral or bilateral, symmetrical or asymmetrical, and frequently permanent. لاحظوا هنا frequently permanent. Severe proptosis may compromise lid closure with resultant exposure keratopathy, corneal ulceration, and infection. Management is controversial. Some will favor early surgical decompression, where others consider surgery only when non-invasive methods have failed or are inappropriate. We'll start with systemic steroid, which may be used in rapidly progressive and painful proptosis. بتلاحظوا لما نستعمل systemic steroid rapidly progressive and painful proptosis during the congestive phase, unless contraindicated. مثلا patient have TB or peptic ulceration. أما نستعمل oral prednisolone 60 to 80 milligram per day initially. Reduction in discomfort, chemosis, and periorbital edema usually occur within 84 hours, at which point the dose should be tapered, or we may use IV methylprednisolone 0.5 mg in 200 to 500 mg milliliter isotonic saline given over 30 minutes. Other choice where radiotherapy can be used in addition to steroid or when the steroids are contraindicated or ineffective. Other than steroid, we have radiotherapy. You may use combined therapy with irradiation, azathioprine, and low-dose prednisolone may be more effective than steroid or radiotherapy alone. Monoclonal antibody treatment with rituximab also shows very good results. The last point of management was surgical decompression, which may be considered either as a primary treatment with congestive painful proptosis or when non-invasive methods are ineffective, such as for cosmetically unacceptable proptosis in the quiescentic phase. Decompression aims to increase the volume of the orbit by removing the bony walls and may be combined with the removal of orbital fat to increase the retroplacement of the globe. Regarding the restrictive myopathy, between 30 to 50% of patients with thyroid eye disease, they will develop ophthalmoplegia. This may be permanent. Ocular motility is restricted initially by inflammatory edema during the congestive phase, later by fibrosis during the quiescentic phase. Intraocular pressure may be increased in upgaze due to ocular compression by fibrotic inferior rectus. In order of frequency, the foreocular motility defect or elevation defect caused by fibrotic contracture of inferior rectus, abduction defect due to fibrosis of medial rectus, depression defect secondary to fibrosis of superior rectus, or adduction defect caused by fibrosis of lateral rectus. Management أول وحدة هي السيرجري. Indication هو الديبلوبيا in a primary or reading position of gaze provided the disease is quiescentic and the angle of deviation has been stable for at least 6 months. Until these criteria are met, diplopia may be alleviated if possible with a prism. The goal is to achieve binocular single vision in a primary and reading position. يعني مو البيشنت يقول أنا عندي diplopia in right gaze أو diplopia in left gaze أجي أسوي له surgery. No. Only diplopia in a primary and reading position هي اللي تهمنا. من عند diplopia in a primary or reading position والوضعية صارها يعني البيشنت stable والangle stable for at least 6 months ذاك الوقت يلا أفكر إنه أسوي له surgery. The other choice هو post-botulinum toxin injection into the involved muscle may be useful in selected cases.
دكتورة العفو.
أي نعم.
الطلاب جاي يحاولون يدخلون للميتنج بس إلا بموافقة.
هسه أشوفها. هاي داخلين شو اسمه؟ داخلين مو من الأكاونت شو اسمه؟ مال الكلية.
لا دكتور هو حتى أكاونت الكلية لازم له موافقة.
بعد ليش يطلع لي؟ مرات ما تطلع لي هي هذا مو always مرات لا الأكاونت مو مال الكلية يصير عندنا. هسه أوكي دخلوا. دخلتهم هسه أوكي. الباوربوينت واضحة عندكم ولا لا؟
نعم دكتور واضح.
أوكي. بعدكم طلاب. أوكي. هسه رجعنا على الباوربوينت. واضح يمكم؟
واضح دكتورة.
أوكي. النقطة الخامسة بالنسبة للساينس of thyroid ophthalmopathy هو الأوبتيك neuropathy. Optic neuropathy it is uncommon but a serious complication caused by compression of the optic nerve or it's a blood supply. يعني تلاحظون الكمبريشن بالصور ما ستي كلش واضحة. يكون enlarged recti muscle تسوي compression على optic nerve. when يصير عندي optic neuropathy either هو compression على optic nerve itself or its blood supply at the orbital apex by the congested and enlarged recti. Such a compression, which may occur in the absence of significant proptosis and may lead to severe but preventable visual impairment. يعني ممكن يكون optic neuropathy وياها proptosis، ممكن البيشنت ما عنده proptosis بس عنده optic neuropathy نتيجة للcongestion أو يعني compression of congested recti على الoptic nerve أو its blood supply. The presentation is with impairment of central vision. In order to detect early involvement, patients should be advised to monitor their own visual function by alternating occluding each eye, reading the small prints, and assessing the intensity of colors, for example, on a television screen. Signs: visual acuity usually reduced, but not invariably, and is associated with relative afferent pupillary defect لأنه الoptic nerve involved، إنه problem with color desaturation and diminished light brightness appreciation. It is important not to attribute disproportionate visual loss to minor corneal complication and miss optic neuropathy. يعني ممكن البيشنت عنده other signs of thyroid ophthalmic disease، عنده proptosis، عنده exposure keratopathy، وده يشوف النظر مالته ده يقل. مو شرط انه هذا رأسا اخذ انه هذا لانه exposure keratopathy لان عنده corneal exposure و irritation او ulceration. لازم اشيك الاوبتيك nerve so I can save it بالearly stages. لازم أشيك ال signs of optic nerve dysfunction or examine the optic nerve head. طبعا أكيد أدز البيشنت إلى imaging. Visual field defect may be central or paracentral and may be combined with nerve fiber bundle defect. This finding, combined with the elevated intraocular pressure, may be confused with the primary open angle glaucoma. يعني شنو؟ يعني ممكن البيشنت هنا أشوف أكو elevation بالintraocular pressure وأكو في defect بالنيرف فايبر layer عنده بالرتينة، ممكن أشك إنه هذا عنده glaucoma، لكن I should يعني ما طال patient عنده thyroid disease I have to check for optic neuropathy. ممكن optic neuropathy هو الكوز مال هاي الفايندينج اللي عندي. بالنسبة للتريتمنت initial treatment is usually with systemic steroids. Orbital decompression may be considered if steroids are ineffective or inappropriate. هذا ما يخص الثايرويد اي ديزيز which is common طبعا نشوفها. راح نحكي عن vascular tumors of the orbit، راح نحكي عن نوعين فقط، هو الكابيلاري هيمنجيوما والكافيرنوس هيمنجيوما. طبعا الكابيلاري هيمنجيوما اذا تتذكرون حكيناها بالايلid وقلنا هي تسمى بالستروبري نيفوس. ممكن it involve the lid، مو بس الليد، راح نجي هسه شنو احنا الاوربت. ممكن هاي الليجنز اللي تصير عندي بالليد ممكن تصير associated وياها capillary hemangioma of the orbital tissue. مثل ما قلنا الكابيلاري hemangioma it is the most common tumor of the orbit and periorbital area in children. Girls are affected more commonly than male يعني 3:1 هاي الريشيو مالتهم. It may present in a small isolated lesion as a small isolated lesion of minimal clinical significance or ممكن large disfiguring mass that can cause visual impairment, a systemic complication. An established tumor composed of anastomosing small vascular channels without true encapsulation. It is a hamartoma, a disorganized overgrowth of mature cells normally present in the involved area and believed to be due principally due to endothelial cell proliferation. ممكن a patient عنده large or multiple lesion that may have associated visceral involvement. يعني أشوف أنا عندي eyelid أو orbital hemangioma I should أسوي له scan ممكن be association with visceral involvement which can lead to serious complication like thrombocytopenia. هاي الحالة من عنده thrombocytopenia تسمى بالكاساباخ-ماريز syndrome with up to 50% mortality with a high output cardiac failure. طبعا systemic investigation should be considered. The incidence of infantile hemangioma in the general population is around 5%, and a small proportion of these, especially if large facial hemangioma is present, will have face syndrome. عادة in patients, the symptoms and lesion usually noticed by the parents, usually in the first few months of life. تقريبا 30% are present at birth. هنشوف extensive underlying orbital involvement which should be ruled out in a seemingly purely superficial lesion. يعني الليجن اللي شفناه بالسكن إذا تتذكرون بالايلid قلنا pink color lesion small lesion بالايلid ممكن small ممكن large ويسوي لي ptosis ويأثر على الفيجن مالتي. إذا صار عندي هذا الليجن I should exclude orbital involvement. ممكن بس superficial cutaneous lesion اللي هي strawberry nevus موجودة. ممكن preseptal deeper tumor اللي هاي شوفوها بالصورة الثانية. Deeper tumor appear dark blue or purple through the overlying skin and most frequently located ممكن superiorly. A large tumor may enlarge and change in color due to deep blue يصير deep blue during مثل ما قلنا crying or straining, but both pulsation and bruit are absent. Deep orbital tumor we may give a sign اللي هي unilateral proptosis. ممكن الهمنجيوما تكون orbital deep in the orbit يعني مو superficial نشوفها مثل ذني الصور. حتكون deep ما راح نشوفها حتى بالايلid ما مبينه ممكن بس deep وتدفع الجلوب وتسوي لي proptosis. Hemangioma's involvement of the palpebral and for mesial conjunctiva common مثل ما تشوفون بنزلنا lower lid حنشوف الفورنكس بها هيمنجيوما. اوكي كتريتمنت هو بها natural course عادة characterized by rapid growth 3 to 6 months after diagnosis يعني نقول أول سنة بعد الdiagnosis حتكبر followed by a slower phase of natural resolution in which 30% of lesion resolve within the age of 3 years و 75% يحصل بها resolution by the age of 7. Treatment is indicated principally for amblyopia secondary to induced astigmatism anisometropia occlusion or strabismus. يعني من عندي treatment اكو indication إلها من الليجن كلش large مغطي الايلid والايلid سوت لي توسس او ضغطت على الاي سوالي استجماتيزم وانايزومتروبيا سوت لي occlusion او سوت لي defect بالاوكيولار موتيليتي صار deep orbital lesion واثر على الاكسترا اوكيولار muscle سوالي strabismus and this is frequently for cosmetic lesion او ممكن عندي optic nerve compression or exposure keratopathy. يعني من عندي indication يلا واحد يروح للتريتمنت. عندي multiple choices of treatment منها البيتا بلوكرز الستيرويد injections ممكن عدة يعني repeated injections ممكن الليزر عم نسوي debulking التيومر large size interferon alpha 2A and vincristine وممكن local resection. هاي كلها choices of treatment of capillary hemangioma. cavernous hemangioma هذا second capillary this is the second type of hemangioma orbital hemangioma. هو مثل ما قلنا capillary أخذناه والكافرنس هسه راح ناخذها. الكافرنس hemangioma أيضا common خاصة بالyoung adults. Cavernous hemangioma occur in middle-aged adults with a female predominance of 70%. The growth may be accelerated by pregnancy. It is the most common مثل ما بعد تلاحظون most common orbital tumor in adults and it is probably a vascular malformation rather than a neoplastic lesion. Although it may develop anywhere in the orbit, it most frequently occurs within the lateral part of the muscle cone, just behind the globe, and behave like a low-flow arteriovenous malformation. بالhistology حنشوف endothelial lined vascular channels of variable size separated by fibrous septa. Patient may experience slowly progressive unilateral proptosis. Bilateral cases are rare. مثل ما تشوفون بالساين أنا عند البيشنت الرايت آي مالته تشوفون bulging anteriorly فسوت له proptosis. طبعا slowly progressive proptosis. ممكن يصير advance ويسوي لي exposure keratopathy corneal ulceration وممكن يبقى mild بحيث eye closure تمام ما بي مشكلة أو ممكن يصير severe. Axial proptosis which may be associated with optic disc swelling and choroidal fold ممكن يعني غير البروبتوسيس هذه الماس راح تضغطني على optic disc أو optic nerve head وتسوي لي disc swelling. ممكن تضغط لي posteriorly على globe وتسوي لي choroidal folds. A lesion at the orbital apex may compress the optic nerve قلنا without causing significant proptosis. يعني ممكن البيشنت كل ماس compressing the optic nerve So wetly optic disc swelling بس البيشنت ما عنده significant proptosis. Okay. There may be impairment of extraocular muscle excursion. Investigation عادة imaging هنسوي CT scan MRI will show a well circumscribed oval lesion مثل ما يشوفون CT scan اللي عندنا هنا. Well circumscribed oval lesion usually within the muscle cone. Okay, ultrasound also may be useful. Management of cavernous hemangioma, many cavernous hemangioma are detected by chance on scans performed for unrelated reasons, and observation alone is often appropriate. يعني من ما عنده symptoms ما مسوي لي proptosis ما مسوي لي optic nerve يعني compression ماكو داعي just follow up أسوي له. Symptomatic lesion require surgical excision in most cases because of the gradual enlargement. Cavernous hemangioma, unlike its capillary counterpart, it's usually well encapsulated, relatively easily to remove. مثل ما تشوفون بالسيرجري هنا هاي الكابيلاري هاي عفوا الكافرنوس hemangioma large size ومسوي لها اكسجين من الاوربت ومطلعيها هنا. واضحة الصورة عندنا. اوكي. هاي ما يخص vascular tumors الكابيلاري والكافرنوس hemangioma. عندي في موضوع هذا الموضوع لأنه هسه الناس وايد تحكي به خاصة في وقت الكورونا احنا هو هذا يعتبر ويا الانفكشنز ويا الاوربيتال انفكشنز يعني نخليه احنا ويا من ويا البريسبتال سيلايتس والاوربيتال سيلايتس وعندنا الميوكور مايكوسس يعني بس احنا ما ذكرناه في المحاضرة حبيت اذكر لكم اياه بهاي المحاضرة. اوكي. الميوكور مايكوسس او يسمى راينو اوربيتال ميوكور مايكوسس هو rare aggressive but often fatal infection caused by fungi of the family Mucorrhaceae. It typically affects patients with مثل ما تشوفون diabetic ketoacidosis أو immunosuppression يعني أي واحد immunocompromised أكو low immunity مثل DKA أو غيرهم و extremely rare بالimmunocompetent يعني immunocompetent patient rare يصيب بهذا الانفكشن. The infection is acquired by inhalation of the spores which give rise to upper respiratory tract infection, then separate occur due to contiguous sinuses يعني contiguous sinuses يروح من respiratory tract يوصل لsinuses subsequently من sinuses راح يروح للأوربت and brain. هاي مشكلته. إذن أول شيء صار inhalation of spores سوت لي upper respiratory tract infection then راح ينتقل للsinuses ومن الsinuses للأوربت ومن الأوربت ممكن للبرين. راح يسوي لي invasion of blood vessels by the hyphae resulting in occlusive vasculitis with infarction of orbital tissue. تلاحظون الهايفي راح يسوي لي occlusive vasculitis with infarction of orbital tissue. في الsymptoms عادة حيصير عندهم البيشنت gradual onset of facial and periorbital swelling, diplopia and visual loss. يعني بالearly stages مو مثل الصورة اللي تشوفوها ممكن كوايت تصير يعني بس اكو mild swelling عندي والبيشنت حيصير عنده diplopia لأن extraocular muscle affected لأنه vasculitis صارت عندهم فصار عنده ischemia بالextraocular muscle صار عندهم pulses والبيشنت عنده حيصير diplopia. طبعا البريوربيتال swelling مو مثل الاوربيتال cellulitis والبريسبتال حيصير more يعني less acute أو more chronic يعني ما قلنا chronic بالأشهر لكن less acute onset. عفوا. الساينس similar to bacterial orbital cellulitis لكن less acute with slower progression. Infarction superimposed on septic necrosis is responsible for the classic black scar اللي نشوفه that may develop on the palate, turbinate, nasal septum, skin and eyelid. هيصير عندهم ما يسمى بالبلاك اسكار اللي تشوفون هنا بالصورة الثانية هاي البلاك region هاي كلها necrosis يسمى ببلاك اللي ممكن نشوفها